Well, I am Vitthal Vikhe, whom most of you know as Padma Shri Dr. Vitthal Rao Vikhe Patil. Loni, an oasis of technology, was not what it appears today. Till a few years ago, it was an inconspicuous village, a near non-entity without any identity whatsoever of its own, an obscure dot on the map of state of Maharashtra in India. Oblivious to and cut off from the development, technology, buzz and cacophony of urban existence. Never in the reckoning of, let alone the world, even the motherland of Maharashtra. Actually, this region, this soil, the people here were my real life, very core and essence of my existence. I'm sure an immortal part of my soul will remain embedded in this finite space of Loni till infinity. I was a simple farmer. Well, not even a farmer, but an agricultural laborer. I used to wander a lot and gather my village folks under a banyan tree for what seemed like just a casual chit-chat to most of them. But in reality, however, it was my quest for knowledge about their lives, their health and habits, their problems and striking poverty, their aims and aspirations. Those were my problems too, because I belonged to the same society. I used to get shattered when I often heard about their poverty and hunger. After all, they were my kiths and kins. They were my people. I was convinced that self-respect, self-reliance, and self-empowerment were the only answers to their impoverished and pitiable state of affairs. Gradually, even they were convinced, and the Loni Cooperative Credit Society started in 1923 to help the farmers for their capital investment in agriculture, also to provide them a working capital. The very essence of my inspiration, of course, is the soil of Loni, so imbued and saturated with sweetness, the sweetness which it pours in its sugar cane. Then why should the sons of the soil be deprived of such a sweet bounty in their own life? This thought vexed me to no extent, and finally fueled in me the desire to initiate a sizable cooperative sugar factory, a harbinger of sweetness in our lives. With the farmers willing, extending their helping hand, it was unanimously decided to start a sugar factory. But who would help us for that task? The villagers came forward to help with paltry sum of money, jewelry, odd stretches of land, and some other such meager sources of assistance. The blessings came in the form of the great economist Dr. Dhananjay Gadgil and many such eminent persons coming forward for help. And then within no time, our dreams of cooperative sugar factory was transformed into a reality in 1949. It was Asia's first ever cooperative venture of its kind. A number of schools and institutions were established, some even exclusively for girls. The cooperative movement opened the floodgates of happiness, progress, and prosperity in this region for all of us. As the cooperative movement gained momentum, each and every person born on the soil was motivated. Total transformation of their life and region became the singular aim of their life. But this required tremendous amount of funds. Considering limitations of cooperative credit societies, the village initiated a bank on the meager capital of few hundreds of rupees. Today, it is a scheduled bank and its turnover is in billions. Yes, in billions of rupees. I always used to feel that the women and the children of the soil is the center of all developments. Therefore, a number of projects concerning women's education were proposed and initiated. They proved instrumental in igniting and nurturing their self-respect and self-reliance. The Government of India recognized Pravara Nagar experiment. Padma Shri and doctorate were conferred upon me. Well, one man's life would never be enough for development of a region, particularly as backward as that of mine. I often wish this noble task has to be carried forward by my progeny and generations to come. My son, Bala Sahib, developed a wide network of institutions in this area and neighboring regions.
मत आहे की ऑक्सफर्ड हार्वर्डला विद्यार्थ्यांनी जाण्यापेक्षा लोणीला या. आमची आता संकल्पना अशी आहे की नॉलेज शुड बिकम द बेस फॉर रुरल डेव्हलपमेंट आणि त्याच्यासाठी आता आमचं नवं स्लोगन असं आहे तर थिंक ग्लोबली ॲक्ट लोकली.
I am very happy to see that the work of Bala Sahib was recognized by the Government of India. Padma Bhushan and doctorate were conferred upon him. Being the proud son of the soil that he is, Bala Sahib realized actually that illiteracy, poverty, and ignorance subjected the rural masses to numerous health problems. Since health is directly related to their productivity, accessible, affordable, and effective health care services were immediate exigency. And in 1972, my Pravara witnessed the establishment of Pravara Medical Trust. The Pravara Hospital holds regular multi-diagnostic treatment camps for the rural poor and needy in Ahmednagar district and also in neighboring villages. These camps are completely free of cost, thereby ensuring that health care facilities reach to all my people. I feel so satisfied to see that hospital provides quality services to rural people and hospital has been upgraded with ultra-modern diagnostic and treatment facilities. My Pravara children get free medical help through regular checkups in their own schools. My immortal soul rested in peace when my son announced the policy of completely free treatment to all children and elderly people. Some deserving cases, apart from this, are treated free. These efforts were also recognized by the Government of India, and Pravara Hospital has been conferred the National Award of Best Institution for providing services to senior citizens and awareness generation. I feel happy when I witness a number of medical students of this college serving as ambassadors of the mission of trust in remote rural areas.
We are allotted 5 families each in our first years from an adopted village, and we continue to follow them for 5.5 years, including in our internship. We study various factors like socio-economic, cultural, environmental, and behavioral patterns in the context of rural health.
After assessing the academic and the research excellence achieved at the global level, the health services rendered to the rural community in the last 25 years, the University Grants Commission, UGC, Government of India, bestowed the status of deemed university to Pravara Institute of Medical Sciences. I feel so proud to see that Pravara Institute of Medical Sciences deemed university is one of the pioneer medical university, wherein the constituent colleges are implementing problem-based learning. And more important is, the main emphasis is on community-based medical education. To bridge the gap between ever-increasing demands of the dental personnel in rural areas, Pravara witnessed the establishment of Rural Dental College. The main focus is to impart community-based dental education, improve awareness in oral hygiene, and provide super specialized dental treatments to the rural masses.
I applied for Masters in Global Health of 11 months duration at Karolinska Institute at Stockholm, Sweden. My objective at Karolinska was to compare the European system of education with the Indian system of education. I was surprised to see that though our institution is located in rural India, yet it is so well known in Europe and especially Karolinska.
Hi, my name is Heather Johnson and I'm from Drake University in Des Moines, Iowa. I've really enjoyed my time here at Pravara Institute of Medical Sciences. I've got to see and experience so many things that I would otherwise not have been able to see in the United States.
We have always aimed at holistic approach to healthcare and creating facilities under one roof. The Pravara Medical Trust encompasses all disciplines, including the College of Physiotherapy. I feel immensely privileged that Dr. Abdul Kalam had visited here in 2005 and appreciated the efforts in community rehabilitation.
In thinking and action can be done for generation, 3 generations. I see here and I appreciate, I value, I congratulate.
The Center for Social Medicine strives to integrate health with other sectors for overall development. through community-oriented medical education and research. The center trains public health professionals at global level and skill development programs at grassroots level. The center has been implementing comprehensive rural, tribal, and urban community health services and interventional research projects which are supported by national and state health ministries, Pathfinder International, USA, IE3 Global Internship Program, USA, and Global Fund to Fight ATM, etc. Following the advice of Pandit Jawaharlal Nehru, the Trust has taken the responsibility of a replication of Pravara healthcare model in other rural areas of the state of Maharashtra. The values of tireless endeavors towards a cherished goal and social responsibility inculcated in me by my mother and grandmother fueled me with passion to pursue my ultimate goal. The mission transcends all barriers and the passion continues. Pravara. My Pravara. A living phenomenon of complete transformation. Oh, I am so happy. I am so very happy. People should not have to go out of Pravara for any fundamental help whatsoever, be it education, health, or employment. That was my dream. The dream that is now a
We are about to start our webinar. We are waiting our speaker to join. He is having some technical issue. He will be joining in just over 3 minutes. Dear participants, this webinar, it's a mixed blend of webinar in which we have incorporated the recent trend, the recent issue, which is the COVID-19, the situation which we are facing. And then we have incorporated the implants, the basics of orthopedic implants, as well as the research topic. So it's a mixed blend of topic included in the webinar. This webinar, this is being organized by Department of Orthopaedic Physiotherapy, the Dr. APJ Abdul Kalam College of Physiotherapy. Our college, Pravara Institute of Medical Science, we have started our university, the deemed to be university, was established under Section 3 of the UGC Act 1956 on 29 September 2003 by Government of India, Ministry of Human Resource Development by its notification number F911-2000. The Pravara Medical Trust is the parent organization of the university and was established in 1972 in a small village of Loni of Ahmednagar district, Maharashtra, by a visionary Padam Shri Dr. Vittal Rao Vikhe Patil sir. Was the founder of the cooperative movement in India. We pay our sincere tribute to sir and seek his blessing to conduct this webinar successfully. In 1976, the trust started providing primary and secondary level medical care with establishment of a modest hospital of 100 beds, and over a period of time, the hospital grew into over 1,200 beds multidisciplinary super speciality medical institute with a state-of-the-art facility. In 1996, the trust started providing primary and secondary level medical care with establishment of a modest hospital. Right. With the vision on and determination of our founder Padam Bhushan, Dr. Balasaheb Vikhe Patil sir, the medical college started in 1984. And then we are moving ahead with the following institutes under the ambit of university, like Rural Medical College and Hospital, Rural Dental College and Hospital, Dr. APJ Abdul Kalam College of Physiotherapy, College of Nursing, Center of Biotechnology, and Center for Social Medicine. We pay a sincere tribute to Sir and seek his blessing to follow his footsteps. It was Sir's vision that we at Pravara are following: think globally, act locally. The university is unique in more than one way. It is specialized in medical and health sciences with a dedication to serve the society as a center of excellence with emphasis on socially meaningful medical education, healthcare, and research. The trust has received accolades from His Excellency Dr. APJ Abdul Kalam sir, the former President of India, for the pioneer work done in the field of integrated rural development and appreciated the participatory model of integrated rural development, followed at Loni as role model for the development of rural India, and has been referred by His Excellency as operative model of PURA, PURA, providing urban amenities to rural area. To acknowledge the vision of His Excellency, College of Physiotherapy named after him as Dr. APJ Abdul Kalam College of Physiotherapy. Once the Department of Physiotherapy was established in 1976 at Pravara Rural Hospital to cater to the preventive, curative, therapeutic, and rehabilitation needs of the rural people, need was felt to impart the much needed physiotherapy training courses, training program, and hence Dr. APJ Abdul Kalam College of Physiotherapy was established in 1997 to achieve this objective. Our college offers all the programs of physiotherapy. We are offering BPT, MPT, and PhD, all the programs of physiotherapy here in this college. We have 5 departments and 1 center running in our college: Department of Orthopaedic Physiotherapy, Department of Neurophysiotherapy, Department of Cardiorespiratory Physiotherapy, Department of Community Physiotherapy, Department of Pediatric Physiotherapy, and Spinal Cord Injury Rehab Center, which is named after the mother of the soil, late Srimati Sindhudai V.K. Patil ma'am, as Srimati Sindhudai E. V.K. Patil Spinal Cord Injury Rehab Center. We pay our sincere tribute to ma'am and seek her blessing for the successful organization of this webinar. Students of our college received international scholarship for higher studies at European universities. Pravara Institute of Medical Sciences participated with Erasmus Mundus Scholarship Program. Under this program, students and faculty from both sides program at Physiotherapy Division, Karolinska Institute, Sweden, and many more will go on. I, Dr. Neeraj Kumar, HOD of Department of Orthopaedic Physiotherapy, Dr. APJ Abdul Kalam College of Physiotherapy, on behalf of entire Pravara family, welcomes you all to this knowledge amalgamation webinar on a very important topic dealing with COVID-19, a physiotherapist perspective, by our keynote speaker, Dr. P. Bhaskar Reddy sir. I hope Reddy sir must have joined till then. Just check whether sir has joined or not. I guess. Bhaskar Reddy sir, can you hear me? Reddy sir, can you hear me? Sir is joining very shortly. Just within 1 and 2 minutes, he'll joining. Till then, I'll brief you about our speaker. Dr. P. Bhaskar Reddy sir. Sir is a world-renowned physiotherapist and leading taping expert in all rigid taping, A-taping, dynamic taping and all. And he has trained in different specialities in physiotherapy and having more than 14 years of experience in physiotherapy, respiratory therapy, teaching, clinical, and administration. Having more than 5 years of Gulf experience, mostly in Qatar and Saudi Arabia. At present, sir is working as senior specialist physiotherapist in Ministry of Health, King Khalid Hospital, Najran, Saudi Arabia. Sir is director of New Hope Advanced Stroke and Spine Rehab Care, international instructor of Max K-Tape, Korea. He is chief instructor for Physio Foundation India. Physiotherapy and having more than 14 years of experience in physiotherapy, respiratory therapy, teaching, clinical and administration. And sir is having more than 5 years of Gulf experience, mostly in Oman, Qatar and Saudi Arabia. At present, sir is working as a senior specialist physiotherapist in Ministry of Health, King Khalid Hospital, Najran, Saudi Arabia. And sir will enlighten us today on the topic dealing with COVID-19, a physiotherapist's perspective. The webinar chair for this session will be Dr. M. Sangeeta ma'am. Ma'am is Dean Academic Affairs, Dr. APJ Abdul Kalam College of Physiotherapy. Now, with the blessing of our Honorable Pro Chancellor Sir Dr. Rajinder Vikhe Patil Sir and Honorable Vice Chancellor Professor Dr. Y.M. Jairaj Sir, we are ready to start our first webinar. And I request the webinar chair Dr. M. Sangeeta ma'am to give us the permission to start the webinar. Ma'am, Sangeeta ma'am, over to you.
Yes, thank you, Dr. Neeraj. And a very good morning to all of you and warm welcome to this webinar session. As all of you know, that today's session is the first in the series, which is organized by Department of Orthopaedics. And I welcome you, sir, Dr. Reddy sir, please welcome to this webinar. And technical issues do happen, please bear with us. Today's session and the future upcoming sessions all are going to be the great knowledge sharing experience and also learning experience. And now I hereby declare the Pravara webinar series officially open. I wish good luck all of you. Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am. Now, for the participants, I would like to share some rules for the webinar. First, in the session, all things will be clear. Like if you have any doubts, please pen it down. And at the end, we'll have a question answer session. In that question answer session, you can write your question on the chat box. Each and every question will be entertained. So, mind it, please, in between the seminar, you please do not come up with the question. We have a separate question answer session at the end. And meanwhile, our team member will share the feedback link for you people. So after end of the session, you all are requested to fill the feedback form so that we can improve ourselves and our session and our webinar. Now I request, as per the permission of our Dean Academic Affairs and the webinar chair, I request our speaker, our keynote speaker, Dr. Bhaskar Reddy sir, to please start with your session. Thank you, sir. Over to you.
Hi, good morning, everyone. Sorry for delay because of some technical issue. I would like to thank once again Pravara Medical Group and also our beloved Dr. Neeraj sir happening for the web series. I would like to thank all of you. We are here through laptop or mobile or anything connectivity because of COVID. You will be seeing through social media, through channels, everything. Healthcare professional who is treating COVID patient have been affected and passed away, or he is undergoing treatment. You will be having in mind as a physiotherapist perspective. I would like to stress I choose this topic. Why? Because you will be having in mind. So if I'm a healthcare professional physiotherapist, if I will treat a patient, COVID patient, I will be getting COVID. It's not true, because if you are following precautionary measures, safety measures, there will be you will not be affected through virus. Think why you will be telling we are all healthcare professionals, we know how to deal the patients. Yes, everyone will be knowing, and everyone dealing their routine work, especially in case of who are working infected as ICU setup. But there is very important thing, many of us we will be leaving, that we will be doing some small mistakes. That small mistakes will affect us. So today I choose this topic to enlighten us, and also who are practicing. Just I would like to see some modifications. uh, as we are practicing the international policy and procedure for infection control, we have to follow some guidelines as from WHO and infection control, so that we will not be affected, and same time our people who are surrounding with us will be free from virus. That is my thing, so that you can, even physio students are there, so that you can educate these techniques in your family. That is a primary my concern. We will go ahead with today topic. These are all regarding my details. If you have any doubts, you can contact, and you can contact sir also, so that we will guide you. So normally you will be seeing evidence-based practice. This is the a very important thing for, especially for students, because when you will come out now, if you will go abroad, Western countries or Gulf countries, this is very important thing, because whatever treatment you are giving, you are practicing, have should have evidence. Even patient can ask why this type of treatment, sort of thing you are doing. You should able to answer them with the proofs through research. That is very important. And today hands-on. Normally webinars, there will be very less chance of practical demonstration, or if you would like to practice also, it will be some sort of difficult. But we'll try to show you some of practical demonstrations, so that it will be useful for you. So today we'll go ahead with our topic. You will be seeing social media from past 2.5 months, COVID and everything. You will be having some information as per WHO guidelines. I will share some information, and you will be seeing this COVID is from the SARS family. This is how like crowns. This is the thing. Actually, many people, they are suffered and afraid of COVID. Actually, in Saudi, we have treated with SARS patient, which is more dangerous. Death rate is more in these cases. But we are suffering because of COVID, because it's going rapid mutations. Till now, they didn't find what is the exact cause. Uh, as uh, as information available, they are telling that it has been from the animals, animal market, but still some question marks are there, not yet confirmed through from lab or anything, whatever, whether wherever it is come from. Our concern is now how to prevent ourselves and our surrounding people. That is our concern. Now we will see a small video about coronavirus.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Mask like cloth mask and surgical mask, N95 mask. These are all different varieties of mask, so that many people when corona has been started, no, as per WHO guidelines, no need to wear mask unless until you have any respiratory illness. Thing is changed, it become drastic because many people, they are not following the precautionary measures or preventive measures. Even though they have infected, they are not revealing they are not sharing that they have been infected or they have travel history. So so few of governments, and I think almost India, they are telling that you should wear mask whether you have been infected or not. And like some governments, especially like Telangana government, if you are not wearing any mask, they are keeping a penalty charges of 1,000 rupees if you are not wearing mask when you are going outside. And also you just try to keep in mind, these are all simple things you will be seeing. You are able to see my thing, glove, I mean mask.
Yes, sir. Yes. Yes,
This is the simple cloth mask which is available now in market. This is the simple surgical mask. Surgical mask you can use, and you will be seeing N95 mask. With this, it will be having very, there are more chances to get infected with like cloth mask. Nowadays, even people using kerchief. So now you can see in this PowerPoint presentation how virus, bacteria, or dust, how much percent it will protect.
yes, yes, sir. Yes, sir.
So, so N95 mask will maximum helps you and prevent the virus entry. So rest other masks will be very less extent. My suggestion, especially for physios or healthcare professionals who are running like not inpatient, like outpatient department physiotherapy clinics, minimum thing you must don't use cloth mask. At least you should use surgical mask. Otherwise, if you are able to use N95 mask, good. So that there will be very, very less chance to get infected. Okay. And the same thing, what have been told, no? This is the surgical mask or PP, how much micro unit. Sorry. Now, how long virus will be living in environment? As per the research, as per WHO guidelines, it depend upon the object like paper or plastic or normal routine items what we are using for daily life. It have variant from 2 hours to 7 days. Now few research they have shown still it will last for 24 days also. Think just I'm telling, if you are a student or professional, just leave it. How many hours or days, weeks, leave it. If you are following the safety measures, precautions, doesn't matter how many hours the virus will live. And these are these small information for you, that how many hours this virus when it transmitted. I mean, if you infected person will cough out. Uh, so the virus in outside environment, how many hours it will be laying. This is the thing. And when you are infected, no, this virus will mainly affect respiratory system, and it will damage your primary organs, main, which is kidney, heart, lungs. That is the reason there is chance of death. And you will be hearing maybe if you are final year student or healthcare professionals, normally people using one term, ARDS, acute respiratory distress syndrome. Here in acute respiratory, this SARS virus will be affecting the lungs, alveoli. So here it's causing acute. So lungs will not be expanding. It will make very tight. So it will affect expansion. And most of the COVID cases, no need for hospitalization. As per ICMR guidelines, now they will be revising the guidelines. Unless until if you have any breathing difficulty, if saturation going down, if you have other complications, then only the hospitalization is required. And also people seeing some pipe in the mouth, it is called intubation, which will be connected to ventilator. We are giving artificial oxygenation to the patient, which he feels very difficult. And also keep in mind who are working in ICU setup, that especially in ARDS cases with ventilator settings will be like high PEEP. Okay, PEEP means positive end pressure. Even when you are taking inspiration, expiration, it should maintain some positive pressure. Otherwise, the alveoli will be collapsing. That is the thing. So just keep in mind, this is the some pathology what's happening inside your body. This is just information for you. So our concern as physiotherapist is very important. If you are treating any patient, hand wash. Here I would like to show you, you can try to learn. Normally everyone will be teaching what to do. Here try to learn what not to do, so that you will be 100% having exact thing what you should not do. Because when you are doing wrong things rather than good things, it will be more dangerous. So hand wash, normally we'll be using soap or anything, we'll be washing like this. Within less than 1 minute or few seconds, you will finish hand wash. That is not an exact proper technique. I will be showing with alcoholic rub. The same technique you can use, you can teach in your home also, how you have to use with soap water. Soap or what else. Here, this is the sequence of 11 steps are there. Here you have to finish this hand washing with soap or Dettol or anything less than 40 to 60 seconds. When you are washing, no, try to remove watch and ring, whatever things you are wearing. That is very important, because when you are washing, no, here chances of virus, they can, so you should be careful like this. This is simple technique. When I will show you practical demonstration time, I will show you that thing. So this is from WHO. Why you want to hand wash? Because most of the germs, bacteria or virus have been, you will be touching the surfaces. So it will be on your hands. So there will be more chance you You may get infection, or you can touch your friends or other people, so that you are transmitting the virus or infection to other people through hands, even whether it will be like shake hand or anything. So you should be careful. That's the reason I told hand wash. After hand wash, you have to go for alcoholic rub. Like this is the alcohol rub spray and lotions are there. There will be, depend upon composition, 70 to 100% alcoholic rub will be there. I will show you that the thing. See how to do hand rub. That is very important thing. It will be last with alcoholic rub with maximum 20 to 30 seconds. You have to finish. It will be like 8 steps. I will show you practical demonstration. This is very important. 5 movements of hand hygiene. This is very important technique who are dealing with inpatients or outpatients. These 5 movements, being a physio, you have to keep in mind, especially who are working when you are posted for internship or when you are posted in your outpatient department. These things should keep in mind. 5 movements in 5 hand movements. Keep 2 for before touching patient, 3 will be after touching the patient. This is the thing. When you want to do hand wash or alcohol rub means before touching the patient, before any aseptic procedures, this will be before. After is after touching body fluid exposure or after touching the patient, like physiotherapist treating the patient with your therapy. And if you are touching the patient surrounding like bed railing, or a patient dress, patient bed sheet, pillow, or anything. So this is very, very, very important thing. 5 hand movements. It is very important. And you will be seeing in your department now anyway e-classes is going on. Most of the clinics, or when you are going outside, people are wearing the mask. And if you see in TV, who are working in ICU setup or anything, you can see the gown, mask, hood, goggles, shoe cover will be their gloves. Now we'll be showing how to wear, because there is a specific sequence is there. How you have to wear, which one you have to wear first, and which one we have to remove. That is very important sequence. These are all the some PPE technique, how you have to wear, how you have to wear mask, and how you have to wear gloves. And same thing with this, you will be aware. I mean, there will be very, very less chance to get infected. Same thing if you are after treatment, after treating your patient COVID or any infected patient, if you are not removing properly means there will be more chance to get infected. That's the reason I taken this topic. I will show you how to wear mask, glove, gown, that hand sanitization. Here you can see the process. Donning means when you are wearing the personal protection kit. Doffing means you are removing the thing. This is some specific sequence is there. Now, what theory I have told you, what PowerPoint presentation till now you have seen. Now we will go for hands-on. And I will show you these things. Are you able to see, sir, my face?
Yes, sir. Yes, sir. And all participants, I request you to kindly concentrate on Bhaskar Reddy sir's big screen. He is going to demonstrate the hands-on about this, the topic he has covered. So all participants, please concentrate on the Bhaskar Reddy sir's screen.
See, this is the mask normally you are seeing. Okay, this is like a cloth mask. Wearing is very important. Don't try to touch outside or inside when you are wearing. Just it's like this thing. And after wearing, before that you have to go for hand wash and a hand rub. Then you wear mask, then you have to fix your nose end. While removing, you have to remove here. Don't touch here. Anyway, first I will go for hand rub. This hand rub technique, there will be sprays available and also lotion is there. This same technique, what I am showing, you can use with soap. So I told no, what you should not try to remove ring, watch, whatever. Then you take enough lotion. This you have to apply both hands like this. Then right hand will be over the left hand. It should go up. It should not come down. This is the new infection control guideline. Normally, previously, we are going like this. Once again, we are coming back and we are going. Now, as per infection control guidelines, we will be going up only. We will not be coming back. It will be like the same thing. And main thing, you have to interlock, and here the spaces should be done. Okay. Then another thing is you have to interlock your fingers. So like this. Then same thing, opposite hand. Okay. Many of YouTube videos are they have shown some wrong information also. Here they are showing like this. If you are doing this means here the space will not be covered. So try to keep your complete, close your finger, excuse me, thumb. Just do it like this. Same thing, do it like this. And do like this and do like this. So bacteria or virus almost will be free. Now your hand will be sterile. So don't touch unsterile places. Go for hand rub with the soap water. Then go for alcoholic rub. Okay. Then this is the surgical mask. Many people, how we have to wear the mask. See here the ends are there. People, some people you will be seeing wearing like this. Actually, this is a protective shield. When a person cough or something, so here it will be accumulated here. So here the protective layer will be there. You can see layer. This will prevent that virus or bacteria going to your mouth. So some people wearing like this. You can ask why you can't. I will wear like this. You can wear, but you will be having more chance to get infected. And also when even with hand sanitization, don't touch inside or outside initially. This is elastic thing is there so that it will be easy for you. Okay, it will be very. Then you have to adjust. Main thing here, see, nose piece is there. Here nose piece has been, you should fix it so that it will close your nose, and also you have to touch here and close, because if here it is any gap means if patient will cough, there will be more chance infected. And you have done the procedure, then go for hand sanitization. Then don't touch here because there will be infected. So try to remove here. And this surgical mask or N95 mask should be discarded in yellow bin. As per your hospital policy and procedure guidelines, infection safety guidelines, you have to drop in closed bin only. And you should not touch. That is very important thing. And you will be seeing the gloves. This will be like unsterile gloves, because sterile gloves will be with the cover sealed. I will show you how to wear. Wearing gloves also is a technique, so that you should not touch as per mask. Don't touch outside. try to use your thing. When you are practicing means initially it will be difficult. Because of practice it will be easy for you. So you will be wearing mask, glove like this. And removing is very important, because after treatment, exercise or anything physio, there will be chance of infected. And don't touch here. Try to remove from here. Then roll it. Same yellow bin. I will show you how you have to wear the gown. I will remove my. See how you have seeing this. This is the yellow gown. There will be different colors, blue or anything for surgical procedures. Just keep in mind this thing. This will be also sterile one. So now you can see this one. Here hands will be there. So this will be front. This will be going inside. Okay. It's also same. You have to wear like this. Okay, this one. And if you are uncomfortable, if you are new means, try to take help of anyone so that they will wear for you. And here very important thing is tying neck. Neck here you can turn and you can tie, or you can keep this thing. It will be easy for you. It should be tight. You check. And also here now thing is middle part you have to tie, and keep in mind try to cover this one. So your gown should not be loose, it should be firm. Okay, then try to use this to tie. Most of the common thing is it will be easy for you to wear from here. This is the wrong technique, because it also will be infected in front. So it should be tied back only. Okay. Initially I told you, try to keep it like this, try to cover it, just go for here, then try to so you have to wear the mask. Previously, I didn't have that N95 mask or hood cover. So initially, when we will do hand sanitization, no, you should use for shoe cover and this thing, and goggles will be coming, and face hood will be there. That will be easy. So now, like this is the PPE. You have treated the patient. Just and also keep in mind that this glove should be over the gown. Keep in mind. You have to keep like this. Okay. Then you have treated the patient. Then removing, I told you, like this. Just roll it. See here. So glove from in to out. So it will not be infected. So throw it in closed bin. So I have removed the gloves. Go for hand sanitizing procedure. Once again, right hand over left hand, same like this. Then like this, keep, like this. This is very important. Then see, if you have done properly means here space is there, no? Web space, it should be free, because this is the place where you have affected if you are not doing properly hand hygiene. Don't touch here, try to remove. This is like adjustable thing. Normally if you have, it will be cut. You have to tie top one first, then down one second. Keep in mind that. And removing yellow gum, that is very important, because this will be infected. Don't remove like this. Don't touch here. Okay. Here, just remove tear it, because from inside out, just roll it. Okay. This one should be thrown in closed dustbin only. Yellow. Okay. Don't touch. You have done thing. Go for hand sanitization. Then go for soap water. This is the thing. And there are many courses available for you. It's free of cost, like COVID from Adversity and from WHO from UK. I have done few courses. It's free courses. If you wish to do this thing, means you send me WhatsApp. I will send the links details so that you can do these certification courses. It's all free. These are all the things from UK, WHO, Adversity. The role of physiotherapist. As I told you, it is very important thing. You will not be treating the COVID, because at present there will not be any exact medicine for the COVID. It's like a symptomatic. If he is having fever or cough, like antipyretic tablets and antiviral treatment. And many people have doubt. India have supported US or other countries by sending chloroquine. Keep in mind, you should not take yourself chloroquine. Why? Because it have more adverse effect, especially for cardiac issues, sudden cardiac issue. Okay, SVT, supraventricular tachycardia. So just be careful. Unless until prescribed by a physician, don't take yourself the medication. Role of important thing, try to teach your fellows or home, your friends, proper how you have to rub your hands with soap and alcoholic rub. This is very important. If you are doing helping them, and how they has to wear mask. And I would like to tell one more thing. People who are because this mask will be expensive, like surgical mask, 10 rupees, not expensive than your life, but still uh, amount is concern for people than life. Keep in mind this, when you are using the cloth mask, when you will go outside, when you will come back, no, go for hand rub first before entering your house, then go hand wash, then you take hand sanitation through your hand. Once again, you take enough this one, this at least do hand sanitization and go for wash it. Make it dry, tomorrow you can use it. Okay, be careful at least. And also as a physio, you should be careful that and you can tell your friends or your relatives or your friends, immunity is very important. Immunity is very important, so that tell them to eat healthy, okay, immune boosters. Anyway, junk food not available now once again they started, so try to avoid junk food, try to eat warm. Keep in mind that what is the role of the physio. my primary concern is prevention is better than cure. That is physio role here. So hand rub, hand wash technique, how you have to wear mask, glove, PPE, how you have to remove, that is very important. In home, you can teach breathing exercises so that even if they have infected, at least lungs will have capacity to fight back. Okay, tell them breathing exercises. As simple breathing exercises you will be knowing. Tell them to simply breathe through nose, hold your breath. Tell them to keep their hand on belly so that stomach, so they can feel it whether they are doing right or wrong. So when they are breathing, stomach has to come front, because I'm telling you as a layman, not for the professionals, because you have to teach them in their own language, not in a our way of language. So tell them to breathe through nose, tell them to keep hand on belly, so the abdomen, I mean stomach will go up, and tell them hold for few seconds, depend upon their capacity, initially with 5 to 10 count or 15, slowly they can increase. Then tell them to breathe out through mouth slowly, like this. I will show. Breathe out through mouth slowly. Tell them to turn to one side. If you are standing someone, tell them to turn their head to opposite side, they can breathe out. And also keep in mind, in COVID patients, like breathing techniques is important, and huffing and coughing you can teach and cough. So this huffing and coughing technique, be careful when you are teaching them. And also you should be keep in mind, especially in ARDS thing, I mean you will be telling postural drainage or lungs secretions. In ARDS there will be very very less chance of sputum. Some cases it will be there, but keep in mind the chance of the sputum will be very less in ARDs. So as a future, what you have to do, almost now they lifted lockdown, but still the areas, few areas they kept almost everywhere, everything almost opened except theaters like gym and swimming pool. So your role is very important. If you are opening outpatient department, if you have a small clinic, keep in mind, tell them to, when a patient comes to you, before entering, tell them outside keep hand sanitizer with leg press. Now you can see that one. After doing hand sanitization, patient will enter to your outpatient department. Tell them without mask don't allow him. After mask sanitization he will enter. Try to, before treating, try to get the information whether he have been traveled any international flights from past 2 months, or domestic flight, or recent travel history, because especially for Mumbai, Tamil Nadu, they have more cases in a travel history from there. And not only travel history of him, try to get the thing if his friends, relatives have been traveled, and he have been, when they meet them, you write the travel history and try to get infrared thermometer, don't touch, you can read the temperature. So these small simple precautions. Then afterwards you try to go for hand rub, hand sanitization, wear mask. At least if you don't have gown, this is very important thing. Mask, gloves is mandatory. And I told 5 hand movements before touching patient, after touching patient, that keep in mind. So I request you all, especially physios or any healthcare professionals, don't throw the used mask. I told throw it in closed dustbin, because there will be still research is going, how COVID will be affecting animals through humans. And few you can see in especially US, They have from the zookeeper who is taking care of lion, tiger have been infected. So this will be more dangerous because if you throw mask, if any infected person, so the animals will be getting through animals. There will be more chances to infected your whole area. So be careful. So this is my contact details, my Indian number and my Saudi number. If you have any doubts regarding most of you are students, when you will complete your bachelor's or master's, if you want to go to abroad, I will help you. Everything, which exam you have to write, how many years experience you want, study materials, everything I will provide free of cost, or you can contact us, sir. He will help you. This is my social websites you can go through. So main takeaway home message is important thing is correct hand wash technique. Okay, 5 hand movements, how to wear PPE, how to remove, social distancing when you are going outside. Unless until emergency, you have other in your home like some pregnant women or pediatric or geriatric, them try to avoid because they have less chance of immunity. Okay, as a physio, keep in mind better than prevention is better than cure. That is very important. So I would like to thank my Physio Foundation of India and Pravara Institute of Medical Sciences. Special thanks to our Dr. APJ Abdul Kalam College of Physiotherapy, Dr. Neeraj sir, and Sangeeta ma'am, and their team. Last but not our all delegates around the globe, and my friends and my sweet class. Thank you. Thank you.
Thank you so much, sir. Reddy sir, thank you so much. Now I request
My
from the
pleasure, sir.
participants, if they have any query, they have any doubt, they can ask in the chat box. They simply write their question. We will try to solve your problem. We'll try to get the solution of your question. Please, participants, if you are having any doubt, please write your question in the chat box. Participants who are having any doubt, now please requested to type your question in the chat box. In the chat box, you will find the link for feedback form also. All participants are requested to fill the form in the online feedback form about their about this session. Any question from the audience? Any question? I repeat, any question from the audience?
And also now I will upload my PowerPoint presentation also, and also I will upload the 2 videos what you have missed it, so that you can go through.
Yes, sir. Sir is sharing his PowerPoint video in the chat box only, and the video also. Sir is sharing his PowerPoint and video in the chat box. Those who have any question or any doubt can write their question in the chat box. Please go to chat box. Okay. If there is no question, I repeat, if there is no question, I'm going to sum up this session. All right. All the doubt has been cleared in the session, I guess. Reddy sir, you have taken the class so nicely that there is no doubt from the participants. And in the end, I can sum up the take-home message about this session is that we should not need to very much afraid about COVID, because no every physiotherapist who are treating COVID will be infected. So there is a chance I mean, yes, infection chance is there, but it is not all the physiotherapists who are treating COVID patient will be treated. And the use of surgical mask is required. At least we should use the surgical mask. If we don't have N95, then we should use surgical mask because it has the protection layer which can protect us from the virus. Yes, N95 of course will be the most effective, and the cloth mask is not as much effective as the surgical mask and the N95 mask. The sir hands-on which you have taken was quite appreciable. We all must follow the sequence and the procedure which you have shown us, particularly the hand wash. What you have enlightened that the new technique of the hand rubbing and how to wear the mask, how to wear PPE and how to remove it. And one more thing, in the future, if we are going to start, if our clinician are going to start their clinic, then if the patient is coming to their clinic, the first important thing is to get the hand sanitization of that patient. And before treating the patient, we must take proper information and history, particularly the travel history and the area from where the patient is coming. These things are very important. So, to all with this take-home message, I would now request Dr. M. Sangeeta ma'am. There is a question. Just a second. I guess there is a question. Go to the chat box. Is there a question? No, not at all.
And I'm uploading just my PowerPoint presentation and the 2 videos.
Right.
Participants can go ahead.
Is uploading his PowerPoint and video. If any students are having any question, please write in the chat box. I repeat, write in the chat box. Okay, if any student want to ask any question, they can unmute their microphone and they can ask. Yes, Divya is about to ask any question. She has raised hand. Divya, you can unmute your mic. You can unmute your microphone and you can ask the question. Divya, can you hear me? Any other? No. I repeat, if there is any question, either you
Hello,
can write on chat.
sir.
Yes.
Sir,
Introduce
Divya
yourself.
here.
Okay, Divya. Yes, you can ask your question.
Sir, my question is, if the patient is having a typical presentation, or he does not have any symptom or something, then what to do?
Yeah, it's a good question, and this is very important. Now in India, as COVID, now it's going mutations, and Indian population actually God blessed us with immunity. So now we have seen even ICMR, they told that there are carriers. I mean, they will not be affected. They will just carry. When they will cough, now this will be spreading. These people will not be affected. They will not be having any symptom. They will not be having any fever, cough, or anything. Just they are carriers. This will be more dangerous than thing, because patient will be coming to your clinic. When you check it with IR infrared thermometer, temperature is normal. Travel history 0, because maybe because of he met other people, they didn't travel also, they have some infection, so he got the infection from them, but because of immunity he developed antibodies, so he will not be affected. So temperature, body, I mean, no symptoms, he will be fine, but he will come to you. This is very dangerous, as ICMR also told. In India, there is more carriers. So for them, what we have to do? I told no, as a physio, prevention is better than cure, whether he is infected or not. So before coming, as you said, no, patient before entering your clinic, outside he has to do hand sanitization. You can see in markets now, leg press is there. No need to touch. Like I have seen here, no need to touch. There will be leg press. Just they has to press the leg. The solution will come, so they can do hand sanitization. And without mask, don't enter into department. Tell them to wear mask. Sanitization, patient has come. Even if he has infection, you will be going 5 hand movements. I told before touching, before starting the procedure, go for hand wash with Dettol or soap, because as it is a virus, this will be having protein coat, so it will damage. Okay, then you are wearing after hand rub, you are using hand sanitizer. So once again you are free. Even he has infected, you are wearing the not like cloth mask. You will be wearing surgical mask or N95 mask. So whether he cough or anything, so very less chance of transmission. Okay, and even if he cough and he will touch area after your treatment, you have to do sanitization, sterilization. You have to wipe with alcoholic rub. So even if he has infected, you will be free from infection. Your doubt cleared?
Hello.
Still you have any doubt?
Hello. Hello.
Thank you, sir.
Hello.
Yes,
Hello.
Shraddha.
Good morning,
you
sir.
have any-
Shraddha is here.
Shraddha,
Hello.
you can ask.
Sir, actually, I'm
tell me.
having one doubt. If the patient, COVID-19, if the physiotherapist is treating the COVID-19 positive patient, then how much time the therapist should spend with the patient while treating him?
See, I told no. If patient having COVID, when you are treating, especially in ICU setup,
Yes, sir.
what purpose you have been posted, you have treating the patient is very important. I told most of the patients, majority, 80 to 90% patients no need any ventilator or anything. They will be having the
Yes.
symptoms. So you, as physios, you will be knowing if a patient, because quarantine as per Indian government, it will be like 15 days.
Okay.
So if you are sleeping in your bed, no work, nothing, eating, sleeping, so there will be chances of muscle weakness. And also I told no, spending this type of people will be very less. You will be going there, you will be teaching breathing exercises, general body exercises, unless until
Yes.
patient have been intubated. If patient is intubated, I don't know exactly in Indian scenario, especially in ICU setup, because as I got information in ICU setup, ventilators have been dealing with the anesthetist, nurse, and the physician. Very few hospitals, very good respiratory physiotherapy have been dealing with them. So I'm telling, I am a respiratory therapist, I am a physiotherapist. We are dealing even with infected SARS initially I told, I have been treated with. In case if you are doing suction means, try to use closed suction. If you have idea, the circuit, no, it will be connected with HME filter and closed suction. We will be connecting and we will be using, I mean, for the secretion purpose. So we can be spending, as per the patient scenario, will be very less time. You will not be spending too much time with the patient. because
Yes.
primary our concern breathing exercises, general body exercises to prevent wasting. In case of suction, actually be having you with your hands. Normally we will not be using percussor machines will be there in ICU setup. So you will not be touching the patient. So a percussors will be using for so it will be very less time depend upon the patient's symptom. And also I told one more thing. Even the patient who has intubated with COVID patients, their condition will be like, excuse me, when you are cough, try to keep your hand like this and don't cough like this. So there will be acute respiratory distress syndrome. In this condition, the chance of sputum will be very less. If it is there also, go for closed suction. You, you got my I mean,
Yes, sir.
your yeah.
Yes, sir. Thank you, sir.
Sir, there is one more question from my colleague, Dr. Suraj, assistant professor here. His question is,
Sir.
since the vaccine is discovery is not sure, how good is the scope of physiotherapists in conditioning the COVID patients in the future?
Sir, that's the reason I told no, sir. Yeah, whether as per our God blessings, our immunity is a little bit better than other countries. So we have to go for immunity boosters. Try to avoid junk food. Try to don't eat outside food. Try to eat healthy food in home. Even I told I'm practicing the same techniques. If I'm, my wife also will be forcing. If I'm coming from outside, went to my center and coming, I'm getting things in before entering home. I will be outside only. They will bring hand sanitizer. I will do hand sanitizer. I will wash my legs outside of my house. Whatever the supermarket things I brought, no, especially vegetables, fruits, everything, I will soak in salt water, like plastic, other things. I will be keeping hand sterilization. I will add in water. I will dip it and I will keep it sometime for outside. Rice bags or something I will keep in hot, outside hot. Doesn't mean that virus will be killing. Especially salt is one of salt is very powerful killing in case of bacteria virus. We'll be using hand sanitizers because in market it is 600 800 rupees. Salt is very cheap. They will not do marketing on salt. So in home we can use these things. So sir, same thing. Up to vaccination, it will take at least minimum 6 months to 1 year. Thing is that my suggestion, especially physios, in healthcare professionals in abroad, sir, initially they will see the medical. They will do chest X-ray, everything, and they will give immunization, sir. Before, if you want to touch a patient, they will give immunization. H1, that one will be giving MMR vaccination. They will be giving, so that we will be having immunity towards bacteria and virus. My suggestion, physios, if who are working in especially inpatient ICU setup, go for vaccination. So your immunity will be improved. Same time, try to eat healthy vegetables and immunity booster food supplements. Main thing, hand precautions, hand sanitization, right way of removing and wearing mask, gown, the glove will prevent.
Right.
I am happy we are getting questions. If there is no questions, means they would have understand 100% or 0.
Right. Now, okay, with this question, now we are into the conclusion. So now I request the webinar chair, Dr. Sangeeta ma'am, Dean Academic Affairs, Dr. APJ Abdul Kalam College of Physiotherapy, to give her closing note and declare this session end. Over to you, ma'am.
Thank you, Dr. Neeraj. And my special thanks to Dr. Reddy sir for accepting our invitation and for this complete session. Special thanks to you, sir. And one more time, I thank all the participants for joining us today. And it is a wonderful session. And this is mainly for the basics, what to do in this COVID crisis, especially for the physiotherapist. So I feel that this session fulfilled all the criteria and this thing. Thank you once again. And my special thanks to the organizing team of Pravara, that is Orthopaedic Physiotherapy. Thank you all for cooperation and supporting in this event. Thank you.
Thank you, ma'am. Thank you, Reddy sir. We'll have some future.
I would like to thank once again Pravara Group and Abdul Kalam College of Physiotherapy. Hopefully, very soon I will visit your college, sir.
Definitely, sir. You will be invited. Once this lockdown and everything will get normal, definitely we are going to invite you. We invite you.
You're welcome, sir.
Okay, sir. Thank you so much.
Thanks to Dr. Neeraj sir providing me opportunity to share some knowledge. Thank you. Thank you. Thank you.
Thank you all.
Thanks a lot.
Thank you all participants. Thank you all participants for your patient hearing. Thank you so much.
And I have uploaded. They can go through the thing. And almost 3 documents uploaded. Only 1 video still it's going on. Other almost uploaded.
And I request all the participants to please fill the online feedback form also. That will help us to improve in a better way.
Someone raised a hand. Home is the 25. Someone raised a hand, sir.
Oh,
please. 25.
If anyone is having any doubt now, can unmute their microphone and can ask their question. Chat box. Reddy sir, can we close this meeting, sir?
Yes, sir.
Okay. Okay. Thank you, sir. Thank you so much.
Thank you, sir. Thank you, sir. Bye, sir.